COVID-19 pandemic continues to thrive around the world. Internationally, over 33 million cases of COVID-19 with nearly 1 million deaths worldwide. In the U.S., we have around 7.1 million cases of COVID-19 with almost 205,000 deaths. In Alabama today, they're reporting 152,983 cases with 2,501 deaths. In Mobile County today, where we reported on our daily report 13,510 cases of COVID-19 in Mobile County residents. 22 were added on Sunday, 88 were added Saturday. We know that little bit of a spike is due to a new laboratory that came on with reporting COVID laboratory results electronically to the State Health Department. So 13,510 cases, 294 have died with COVID. The cumulative number of patients hospitalized in Mobile County Health Departments is 2,005. We've had a few admitted over the weekend. And then the number of people hospitalized with COVID jumped up a little bit. 4 or 5 days ago, we got as low as 62. Now we're at 72 in the hospital with COVID today, or yesterday rather. So that has gone up slightly. So we will continue to see that. Nationally, the Centers for Disease Control have been reporting, we've talked a little bit about this before, that the community transmission seems to be driven by mostly young adults, that the 20 to 29-year-olds have had the largest increase in the number of COVID cases diagnosed among them over the summer. I'll just read some statements here. During June through August, COVID incidence was highest in persons aged 20 to 29 years, and they accounted for 20% of the confirmed cases. The reason that's notable is that if they are asymptomatic or mildly ill, don't realize they have COVID, and they aren't wearing masks, then they are potentially exposing people who do have severe illness or are vulnerable to complications and deaths. And in fact, this study showed that this report that was released on the 23rd of September said that increases in SARS-CoV-2 among the older population, so then 60 years or older, then starts to increase an average of 8.7 days later, suggesting that younger adults likely contribute to community transmission of COVID. So strict adherence to those personal protective or preventive behaviors and community mitigation strategies is needed in those younger age populations so that we can prevent illness in those groups, the older groups, the people with immunocompromising conditions, with underlying medical conditions, to keep them from getting COVID and having very severe disease. So last week we added just over 400 cases of COVID. That was, let me get my glasses here so I can make sure I'm quoting this right. So last week, the week ending September 26th, 402 COVID-19 cases were reported in Mobile County residents. That was an increase of about 150 from 241 the week before. So before this week, we had seen a 1, 2, 3, 4, 5, for the past almost 6 weeks, a steady decline in the weekly number of COVID reported, and this past week we saw a slight increase. And there are a couple of reasons likely behind this, and most of it has to do with changes both in the way the Alabama Department of Public Health and we are investigating reports of COVID, and then also sort of a national trend in more and more rapid tests become available. And many of the locations who get rapid test capacity, like nursing homes or urgent cares or doctor's offices, some schools, many of them are not able to report electronically, so that manual reporting sort of slows the whole system down. So again, and when you see the expanded report this week, you'll note that we've added a couple of things. We're adding the percent laboratory results positive, the percent positive back to our report. So we finally sort of Tommy solved the mystery of what was making our data wacky for lab results, and so we'll be adding that report in. Statewide, the percent positive I think has gone up a little bit, And maybe Friday I'll be able to talk to you about what the percent positive looks like for Mobile County. In some of our provider offices, we work really closely with one of the urgent care chains in town, and they are sitting around 14 or 15% positive. They primarily do rapid tests, so they're probably seeing the people who are most likely have COVID. Generally, in the surveillance population, like where we're just providing testing for anyone, regardless of symptoms, it's usually quite a bit lower, down around 10% or 12% on average. All right, let me see if there's anything else. So with regard to the rate, and when we talk about the rate, what we mean is the number of cases divided by the population and then multiplied by 100,000. So what calculating the rate does is it helps us, for example, look at sort of adjust for, let's say when we're looking at age groups, the 18 to 24 age group has the most people in it, so of course they're going to have the most cases, but when we adjust for that, for the population size, then we call that a rate, an incident rate, cumulative incident rate. And right now in our 18 to 24 category, the cumulative incidence rate is 5,176 cases per 100,000 population, and that is about 1.5 times what we see for our general population. So we too are seeing that those younger age groups really driving community transmission. All right, so let me see if there's any other data factoid that I wanted to mention. Again, we still are seeing this week or this past week we saw a slight increase in the number of cases, but most of our indicators are still moving in the right direction. Our hospitalizations are going down. The number of reported deaths are going down. But again, those are lag indicators. So if our case count is indeed starting to creep up a little bit, we would expect after 10 or 14 days to see the increases in hospitalizations and deaths. So we'll keep an eye on that. So please, please continue those mitigation activities. Wear your mask, cover your cough, wash your hands, stay at home if you're sick, those sorts of things to try to keep COVID transmission down in our community. We've been doing a really, really good job leading into the Labor Day holiday, so just want to make sure that we continue doing those things that we need to do. Another interesting report, I get asked a lot of time about the underreporting of surveillance. There was a Nature Communications scientific publication that came out a week or two ago estimating that for every sort of looking at the true burden of disease. So most of the sero surveys that have gone out and tried to determine just in a population, in a city or in a county or in some zip codes, in any one point in time, how many people are COVID positive, and it's looking like it's around 2%. And if that is true for Mobile County, then we probably have anywhere from 10 to 12 cases of COVID-19 for every one case that is confirmed by us. So just a little bit of context there. And again, underreporting is a natural and expected phenomenon of public health surveillance data. So, but it's good to know about what the magnitude of that underreporting is. So a couple questions from the media. Are there concerns about a spike in cases after Hurricane Sally? It's like we can only handle one disaster at a time, right? It's like as soon as we had a hurricane, everyone got to cleaning up their yard and helping their neighbors, and they were just too exhausted to deal with also having to address the other disaster that's going on, which is COVID-19 pandemic. So, indeed, it seemed like people were in the grocery stores, in their yards, not adhering to physical distancing, not wearing a face covering. And I don't know what to think of that. In some ways, we may see a lull in cases. In fact, we did see a lull because of some power outages. We think there was a delay in reporting, right? So that caused a lower number of cases the week of Sally. Also, people having to be at home and without power for a couple of days might be sort of a natural quarantine, stay-at-home order experiment. So that might actually sort of interrupt spread. It'll be interesting to see if that helped at some of our schools who were having outbreaks, that when the children were sent home and couldn't go to school, to look and see if that slowed their outbreak. So, but I suppose it could go either way if people were gathering in large groups, maybe to clean up yards, and weren't able to social distance or wear their mask. Someone asking how important is it that recommended guidelines are still taken seriously. So it is extremely important. Our outbreak is not over. I think I can safely say that we have, we're through our first wave. People have been asking me questions about that since back in June. Is the wave over yet? Is the wave over? I think we can say now our first wave is over, but we're not out of the woods. We still have millions and millions and millions of people in the United States that have no protection to this virus. We don't have a vaccine, although there's talk of some populations being able to get vaccinated later this year. For most of us, a vaccine won't come until 2021 at the earliest. So we have an largely immune population, no vaccine, very few treatment options. We only have treatment options for the most critically ill with COVID. So for all of those reasons, we still have to take it very seriously, and we still have to rely on non-pharmaceutical interventions. So the community mitigation prevention measures like wearing a face mask, physical distancing, covering your cough, staying at home if you're sick, washing your hands, disinfecting surfaces, all of those things that we've been saying for a long time now are still very, very important. They're important if you are young and will easily survive a COVID infection. You need to do it for the protection of others. And then if you're in those more vulnerable age groups, you really need to be staying at home as much as you can. A question about Florida lifting some restrictions. I'm not certain on the specifics of what Florida is doing, but the safer at home order and the mask mandate issued by the governor is through this Friday, October 2nd. So we do expect to see some communication coming out of the governor's office some point this week to let us know what the safer at home order is going to look like after October 2nd. Let's see. Oh, yeah. Someone else saying about me touching my face during Facebook. So, yeah, when you wear a mask all day and then you take it off, it's like you have itches everywhere and hair in your face. And so I always make sure when I leave the broadcast that I go straight either to the restroom or to the disinfectant and wash my hands. Since I've been here touching surfaces that I don't normally touch throughout the day, and I have touched my face. So let's see. I think that's all of our COVID updates today. Do we have any non-COVID updates? All right. So I'm seeing Mark shake his head no. So with that, I will wish you wellness and a good week, and we will talk to you on Friday.